University of Medicine and Pharmacy at Ho Chi Minh City has more than 70 years of history and development, with the mission of training high-quality health professional resources, conducting scientific research, applying and transferring modern technology, effectively contributing to the cause of protecting, caring for, and improving health for all people. The medical doctor curriculum at the School of Medicine, University of Medicine and Pharmacy is a competency-based medical education. The curriculum focuses on teaching medical ethics, professionalism, and interprofessional education to increase patient safety and enhance professional competencies for medical students.
Đạo đức ngành y nó khác với đạo đức của các ngành nghề khác. Người ta gọi đó là nghĩa vụ đạo đức. Khi đến nghĩa vụ, có nghĩa là cái điều đó chúng ta phải làm, đặt lợi ích của người bệnh lên trên mọi lợi ích khác.
In January 2017, the University of Medicine and Pharmacy at Ho Chi Minh City signed a Memorandum of Understanding with Texas Tech University Health Sciences Center at El Paso for 5 years, 2017 to 2021, to inaugurate the Collaborative Educational Program, CEP, and technical support for Center for Advanced Training in Clinical Simulation, with the 5-year strategic plan. ATCS was founded in April 2017 with the mission of serving the educational mission of the University of Medicine and Pharmacy at Ho Chi Minh City, to improve the quality of training and assessing clinical competence, and to conduct medical education research to enhance the safety, quality, and effectiveness of the medical services provided by healthcare providers to the patients and the community of Vietnam and Southeast Asia region.
Trong chương trình đào tạo bác sĩ y khoa dựa trên chuẩn năng lực, vai trò của Trung tâm huấn luyện nâng cao mô phỏng lâm sàng là rất quan trọng. Chúng tôi tạo một môi trường học tập, thực hành chuẩn cho sinh viên, tạo điều kiện cho sinh viên được tiếp cận thực hành các kỹ năng trước khi tiếp xúc thật sự với người bệnh ở tại bệnh viện. Chúng tôi dùng cái cơ sở vật chất của Trung tâm huấn luyện nâng cao mô phỏng lâm sàng cho công tác lượng giá, khảo thí với mục tiêu là an toàn người bệnh. Là trên hết thì ATCS là nơi để sinh viên được thực hành làm việc nhóm, học tập những kỹ năng giải quyết vấn đề để khi mà thật sự đối diện với người bệnh thì cái công tác khám chẩn đoán cũng như nhận định điều trị cho người bệnh nó được chuẩn mực và đúng đắn. Trong thời gian sắp tới, chúng tôi sẽ đầu tư phát triển cơ sở vật chất cho Trung tâm huấn luyện nâng cao mô phỏng lâm sàng để đáp ứng được nhiệm vụ do Bộ Y tế giao phó. Đó là trở thành nơi đánh giá năng lực thực hành cho các bác sĩ y khoa vừa tốt nghiệp.
For the day-to-day operation of ATCS, the Associate Director, 3 Chiefs of Education Division, Administration Division, and Technology Division, all ATCS faculty, staff members, standardized patients, and several qualified instructors of UMP have assisted the Director to ensure a smooth operation. To ensure that ATCS will be able to fulfill its mission and achieve the vision, the Advisory Committee and Operation Committee are the 2 important components that will monitor and provide guidance, advice, and feedback to the operation of ATCS. The Collaborative Educational Program, CEP, taught by Professor Hoi Ho and Professor Kim Twin Ho, is an 8-week intensive training in faculty development, competency-based medical education, clinical simulation, OSCE, evidence-based medicine, application of technology in medical education, and leadership development. Educators must fully attend the program, practice their teaching skills, receive constructive feedback from colleagues as well as students, and well perform in the OSCE to receive a completion certificate. During the development phase, ATCS constructed and completed its infrastructure. with a total area of about 14,000 square feet, located on the 11th floor of a 15-story building, including the clinical skills area with 14 OSCE rooms equipped with the camera system connected to an observation room, 6 training rooms, 2 debriefing rooms, and a lounge for standardized patients. The clinical simulation area has 2 simulation rooms and a control room with a one-way mirror. Our center also has 2 advanced training rooms and a virtual simulation room for postgraduate training. To monitor daily activities at ATCS, we have used a security camera system with the central office's observation display. At ATCS, we have numerous partial test trainers, mannequins, simulators for graduate and postgraduate training. We've divided them into different specialties. For general medicine, we have ear exam model has changes in the image of the eardrum damage. Model of eye examination has visual changes to retinal lesions. Blood pressure simulator, etc. For surgery, we have rectal examination trainer, etc. For obstetric gynecology, we have gynecology diagnostic training model, advanced obstetrics and gynecology examination model, breast examination model with strap, advanced childbirth simulator, and so on. For pediatrics, we have model of infant resuscitation connected to the computer, pediatric lumbar puncture simulator, etc. For emergency medicine, we have adult airway management trainer mannequin, cardiopulmonary resuscitation models with sensors and interactive software, and so on. For cardiology, we have pocket fetal Doppler, V-scan, and so on. In the advanced training rooms, we have high technology equipment and medium to high fidelity simulators, including the GI branch mental platform, the Samsung Sono Ace R7 ultrasound machine, the UltraSims ultrasound simulator, the TrackMaster stress testing treadmills, the student auscultation mannequin 2, the Simulscope bedside auscultation system, the Cardionics CardioSim 7, the pediatric auscultation trainer, the Code Blue 2 adult simulator, and the CAE iStent patient simulator. The simulation rooms are also equipped with defibrillators, automatic infusion pumps, and crash carts to train the advanced cardiac life support. All medications used for exercises at ATCS are clearly labeled, "Do not use for patient care," or "simulated medication." Equipment and simulators are checked for maintenance regularly and stored in the storage room. All simulators are only used for training, not for the treatment of patients. Using Airtable, we maintain a user-friendly and effective database for equipment inventory. The multimedia room is outfitted with video cameras, a lighting system, and video editing software. The center has created numerous essential learning resources for students, such as training videos on communication skills, history taking, examination, and procedure skills. These learning materials are regularly updated on the website for students to access and study. In addition, the room is utilized to assist educators in recording electronic learning materials and host various online continuing medical education. The ATCS Center has collaborated with the Faculty Development Unit to organize faculty development courses and continuing medical education on evidence-based medicine, competency-based medical education, simulation-based medical education for more than 186 educators who participated in training at ATCS. For the summative assessment, the center develops the assessment regulations and procedures, organizes training of trainers, dry run and revision before the assessment, collects data, and provides feedback after the assessment to improve and increase the validity and reliability of the assessment tools. With the audio-visual system connecting the observation room and the OSCE room, the assessors observe the students' performance in the OSCE room with checklist and checklist instructions on how to mark the checklist. In order to handle daily work at ATCS, the staff are also enhanced with professional competencies such as basic resuscitation skill, using AIRS system, management software, models preservation and inspection procedures, dressing up standardized patients, and learn foreign language for communication and specialization. The standardized patient play an essential role in training and assessing clinical competence for medical students. Step by step, ATCS has been developing and implementing the standardized patients program. By this training program, the standardized patient team will gradually improve their performance, act as a real patient in clinical scenarios, provide constructive feedback to help students improve their examination skills, history taking, and increase students' engagement. Based on the health needs in Vietnam and the results of the training demand assessment through 360-degree feedback, ATCS, together with the curriculum committee and clinical departments, have developed a simulation training program for medical students, identifying the desired outcomes with clear and specific learning objectives and selecting the appropriate simulation modalities, creating a psychological safety environment in which students may attain their objectives in a timely manner. Students can practice their examination skills and procedural skills on partial task trainers, build clinical scenarios in order to practice communication skills, history taking with standardized patients. In particular, the program also has the interprofessional education IPE for medical, nursing, and pharmacy students, helping students work as a group, discuss, and solve patients' health problems. During training sessions, students conduct pre-test and post-test through the AIRS to assess their preparation and progress. ATCS also focuses on creating psychological safety for all participants. Through a simulation orientation course at the beginning of the academic year, medical students are oriented to the simulation-based learning environment, the policy, and procedure before coming to practice at the center.
Khi tham gia vào trong mô phỏng lâm sàng thì các em mọi người đều có một cái khả năng như nhau, đều có trí thông minh, đều có năng lực, đều mong muốn làm được những cái kỹ năng tốt nhất.
We encourage students to self-reflect, self-assess the areas that need improvement, and outline their improvement plan. During debriefing sessions, students can explore and address their performance gaps and be more confident when practicing at the clinic or hospital and in communicating with patients. Aside from basic skills training, ATCS has high-fidelity simulators, emergency resuscitation equipment, and a control room with a one-way mirror, camera system, and management software. We have developed clinical scenarios that are as close to reality as possible, providing tasks and ask students to solve problems.
Mình sẽ thực hành một cái tình huống ngưng tim ha.
Using this technology, educators can observe and provide feedback to students to assist them to increase their performance, coordinate teamwork, and solve problems.
Rồi, đổi người. Nhanh, rồi.
Additionally, we have advanced training rooms for postgraduate training, such as exercise electrocardiograms, ultrasound systems, virtual reality simulators, and so on. We expand the training for final year students and graduate trainees, and we collaborated with clinical departments to provide numerous continuing medical education courses. In the 2020-2021 academic year, ATCS includes relevant activities to help students enable clinical simulation learning to adapt to the COVID-19 pandemic, such as developing and completing learning materials, training videos, and clinical simulation videos. The materials are available on the center's website, where students can self-study as needed. In response to the gathering limitation due to social distancing, ATCS has offered and instructed students to record their examination skills and submit them to educators for subsequent virtual debriefing meetings via online video conferencing platforms. ATCS regularly conducts training demand assessments at the end of every academic year and gather 360-degree feedbacks from students at the end of each session to improve training quality.
Lý thuyết thì em học ở trên trường và thực hành thì học ở trung tâm mô phỏng lâm sàng ATCS. Nó rất có ý nghĩa với tụi em tại vì nó sẽ giúp tụi em làm quen với môi trường bệnh viện hơn.
Based on the survey results, ATCS has improved its curriculum and desired outcomes, as well as equips more simulation equipment and simulators to support the training and assessment activities. At the teaching hospitals and clinics, students apply the skills learned at ATCS in practical situations, such as clinical examination, diagnosis, disease management, patient care, teamwork, and especially develop empathy for patients. Besides teaching and training, ATCS also have conducted medical education research and clinical simulation research. Some of them are studies on the reliability of the assessment tool, thenceforth improve the training and assessment quality. ATCS has had exponential development in terms of the tenacity with significant international cooperation activities. Most notably, the attainment of provisional accreditation from the Society of Simulation in Healthcare in 2019. The center is constantly improving, creating a development strategy and pledges to reach its goal, ensuring patient safety, as well as meeting accreditation standards and contributing to the quality of the Vietnamese healthcare system.